Dr. Gillian Coughlan presenting on menopause age and hormone therapy use moderate PET tau and amyloid associations.
So I'm a research fellow at the Department of Neurology at Massachusetts General Hospital. And today I'll be talking about sex differences in Alzheimer's disease. And I'll be focusing on two factors that are specific to women: menopause and hormone therapy use related to menopause. Next slide. And so firstly, let's take a look at what Alzheimer's disease is. So these are immunohistochemical stainings from the cortex of Alzheimer's disease patients showing the two neurotoxic proteins that actually cause the disease. So we have beta amyloid plaques and tau tangles here. Now, using PET scans, we can actually quantify these pathologies in the brain and map out their regional distribution. So as we can see from these images, the burden of amyloid is global, but the burden of tau tangle is pretty much region specific. And it's also important to remember that tau tangles are much more closely associated with symptoms of Alzheimer's disease than beta amyloid plaques are. Next slide. And so postmortem data actually shows us that sex differences are larger on tau tangles than sex differences in beta amyloid plaques. And now if we actually look down here at tau tangle density in the 50 to 59 age band, we can see sex differences do exist here, but a decade later, those sex differences are larger in the 60 to 69 age band. Now, when women enter menopause, they enter this at a mean age of 51. And when this happens, the ovaries stop producing estrogen, leading to a dramatic reduction in that hormone circulating in the body. Next slide. So animal models actually show us that when the ovaries are removed from mice at 3 months old, this leads to a proliferation of AD pathology in the hippocampus by 3 months, as we can see in this middle image here. So this suggests then that early menopause might be associated with AD pathology. Now, if these animals who received or who had their ovaries removed also received hormone therapy via infusions of estrogen, the Alzheimer's disease pathology in the hippocampus was lessened. And this kind of potential beneficial effect of hormone therapy has been also supported by observational studies that suggest hormone therapy is associated with lower risk of Alzheimer's disease. Next slide. And so in 2002, then the Women's Health Initiative kind of designed this randomized control trial in order to test the risks and benefits associated with hormone therapy use in post-menopausal women. And what they found is that among women who actually received the hormone therapy, their likelihood of probable dementia doubled compared to the placebo group. And after the publication of these findings in 2002, the prescriptions for hormone therapy for menopause-related symptoms declined by 80% in the US. Next slide. And so what we wanted to do is kind of disentangle then this relationship between menopause age, hormone therapy, and AD pathology in the human brain. And we focus specifically on tau pathology and not amyloid pathology as our outcome of interest, because in humans, sex differences are much larger on tau than on amyloid. And our first aim was just to replicate sex differences that have been seen in regional tau PET. And we looked at 8 specific regions for this. These regions are illustrated in the spatial map below. And we focused on these regions because our lab has previously shown that tau is elevated in women compared to men here. And then in the regions where we see elevated tau in women, we wanted to examine whether age at menopause and hormone therapy were also associated with tau in these regions. Next slide. And so in order to do this analysis, then we used data from the Wisconsin Registry of Alzheimer's Disease Prevention. And here we see male and female groups. And what we can see is the male and females are well matched in terms of demographic factors and APOE4 carriership status, but men are on average have 1 year more education than women do. Next slide. And so here are our first set of results. So firstly, on the y-axis, we're seeing the tau PET signal in one region of interest. And on the x-axis, we're seeing global beta amyloid. And then women are in red and men are in blue. And what we see here is that in those with already elevated levels of beta amyloid, women are showing much higher levels of tau than men. So this is just essentially an interaction between sex, beta amyloid on tau as an outcome measure. Next slide. And if we look at this effect across all our 8 regions of interest, we can see sex differences emerging in the cortical regions of the brain, but not really in the medial temporal lobe. So we don't see any sex difference here in the entorhinal cortex or the amygdala along individuals with any level of beta amyloid. And so based on these kind of sex by amyloid interactions on tau, our second set of analysis focused on the interaction that menopause and hormonal therapy might be having with beta amyloid to predict tau. Next slide. And so here we see on the y-axis the tau PET signal again, and on the x-axis we see the beta amyloid signal. And here we're looking at the age at which menopause onsetted in our female sample. And so we have women who were at or under the age of 40, women who were between 41 and 49, and women between 50 and 59. And so what we see is in those, again, with already elevated levels of beta amyloid, earlier menopausal women are showing much higher levels of tau than later menopausal women. Next slide. And if we look across all our regions of interest, we see that this effect is consistent in both cortical and subcortical brain regions. So we actually see this effect emerging in the entorhinal cortex and the amygdala as well. And these are the two regions that are kind of thought to be the initial start of Alzheimer's disease, where tau first is found after projecting up from the locus coeruleus into the entorhinal cortex. And so what we see then here is that earlier age of menopause indeed does seem to be associated with tau pathology, but this again is dependent on elevated levels of beta amyloid. Next slide. And so next we wanted to investigate how hormone therapy might also be implicated in tau burden in women. And so this slide is going to look confusing at first because we see that we have 3 groups. We have men, we have women not on hormone therapy, and we have women on hormone therapy. And so let's just look at women on with the mustard line here first, or women with hormone therapy in the mustard line. What we can see is women with hormone therapy were showing a greater level of tau than women not on hormone therapy, but again, this was dependent on levels of beta amyloid burden. So this difference was only seen on that kind of right end of that x-axis. Then if we look at the difference between women on hormone therapy and age-matched men, we also see that they're different in that women receiving hormone therapy were showing elevated levels of the tau signal compared to men, again, only when amyloid beta was elevated. Now, another crucial observation here was that women not on hormone therapy and men did not differ irrespective of the beta amyloid burden. Next slide. And so what we did then is we looked at this, effect across all our 8 regions of interest. And it was pretty consistent in that hormone therapy seemed to be having a negative effect on tau burden if beta amyloid was already present, except on the superior parietal lobe, where we kind of saw no effect of hormone therapy, although there was a strong sex effect in this region. Next slide. And so finally, we were interested in whether or not the time at which women had actually started hormone therapy was potentially explaining these results. So reanalysis by the Women's Health Initiative had actually found that one of the reasons hormone therapy was actually harmful is because it was given to women who were postmenopausal several years after their menopause onset. And what we saw here, it was really women who received hormone therapy or who started hormone therapy more than 6 years after their age at menopause that were most susceptible to tau deposition. Now, based on this figure here, we can see that women who started within 1 year of menopause also look like they have higher tau signal. But if we look at the next slide, we see that it's really women who started more than 6 years after menopause that are showing this elevated tau signal. Now, I also want to note that this timing effect happened irrespective of the level of beta amyloid that women had. Next slide. And so just to reiterate our final points, then we've seen that an early reduction in estrogen due to early menopause seems to be associated with higher levels of tau if beta amyloid is also elevated. Next slide. And we've also seen that hormone therapy use more than 6 years after menopause could be harmful, as it's associated with higher levels of tau. But hormone therapy use at or before menopause seems to carry no real risk or benefit for Alzheimer's disease, or for the tau signal at least. And this is pretty consistent with clinical guidelines around menopause that suggest, or around hormone therapy that suggest therapy in early menopausal women for less than 5 years is safe. And so just to round off, then I'd like to thank, for the next slide, I'd like to thank everyone at the Harvard Aging Brain Study who contributed to this work, as well as our various funders.